Hi everyone, I'm here at the Patient Experience Transformation Assembly in Nashville, Tennessee, and I am joined today by KP Yelpaala. He's the founder and CEO at access.mobile. Thanks so much for being here.
Thanks for having me.
We want to dig in and hear a little bit about you and this company. So access.mobile describes its work as intelligent mobile engagement. So tell me a little bit about what that means and how it's different from traditional patient engagement.
Great, thank you. So I think when we look at the healthcare sector, providers, payers, and consumers all understand that mobile is the way of the future. And being in a mobile-first world, I feel like healthcare industry is understanding more and more that we have to meet people where they are. And this extends beyond the patient portal. It also means personalization. How do we communicate with people in ways that are meaningful to them? And that brings the intelligent to the mobile engagement.
Right. That makes a lot of sense. So why are you focused on the mobile channel?
Well, mobile, we live in kind of a notification-based world, and so everybody's on their phone. And you know, when you think about it, it cuts across socioeconomic status. So oftentimes people talk about the digital divide. So they might say people who are low income or traditionally hard to reach populations, maybe they have less access to the phone or to the internet. But really, it's a channel that everybody is on, no matter what your socioeconomic status is, no matter where you live. And so it creates a big opportunity.
Sure. It's unbelievable how prominent it is right now.
Right.
So how can healthcare go beyond the health record and beyond the patient and look more broadly at the person?
Well, I mean, I think there's a lot of discussion now about looking at the whole person and about well-being, right? Whether it's mental health or whether it's about thinking beyond just typical clinical medicine. And so to the extent that we want to reach people outside of the four walls of the hospital, because most of our well-being is happening in our lives, this is how we bridge that concept of well-being with mobile.
Sure. So how can we better meet the needs and preferences of patients and health consumers?
Well, it's about context and it's about preferences. So from a context perspective, we have to take into consideration where someone lives, what we typically may call social determinants of health. So what's going on in their life and what may be a barrier to care. Like if someone we know has a healthcare need and they haven't engaged, there could be lots of reasons why. Right. Not just that they don't have the motivation to want to take care of themselves. Sure. And so we need to think about those social determinants of health. And then also we have to think about people's preferences. So how do they want to be engaged? And when we can do those two things, we're going to be, again, more intelligent with our engagement.
Right, right. So how can we leverage behavioral science to improve the patient engagement?
Well, so when we think about behavioral science, there's a lot of discussion now about this idea of nudging, right, or incentives. So wellness programs tend to do this, you know, positive reinforcement, vouchers, couponing, these concepts that maybe help give someone that little nudge to say, you know what, like, we're going to reward that good behavior, and by creating that positive feedback loop, create more and more of that effect. Sure. So we see behavioral science, and when we combine that with social determinants of health and thinking about people's situations, becomes very powerful to influence behavior.
Sure, sure. And so with such a personalized approach that you have, how do you scale? What is mass personalization, and how is that really executed?
Yeah, so it's, we talk about this idea of mass personalization, and we think that the idea is that, one, like our partners, we work with our partners to really understand their population. Okay. And some of that it's not a software problem, right? That's more of an issue of data analytics, population health, and insight, right? And once we kind of understand that concept and we understand the nature of the people we want to impact, we can then scale the technology. So in traditional patient engagement models, we find, for example, providers just send texts, and everybody gets the same text for the same type of clinical protocol or whatever. And our view is that if we personalize by context, we can still scale, but not everybody is getting exactly the same message.
I see. So it's really going back to a basic concept of just putting a person first and really
Precisely.
Focusing on what they want.
Exactly.
So how do you adapt your approach to various settings? Is it more successful in certain geographies and conditions, or how does that work?
So we are a global company, so I would say in the patient engagement space, we not only work in the US in urban and rural populations, but also internationally. And so what we find is there's a lot of things about human behavior that transcend national borders, that transcend what people might traditionally think is cultural or local. There's a lot of common elements, and we're able to take our expertise dealing with populations globally, but then through this contextualization, then make it a bit more localized. Yeah, and so that gives us, I think, an advantage in thinking about how to engage.
Sure. Well, we're really excited to see where this heads. It's just the beginning. There's more in the future. And so thank you so much for joining us, and we can't wait to hear more about Access Mobile.
Great, thanks so much.